Good day, my dear postgraduate students. I hope you are following the slides and the classes on bone marrow aspiration. Sometimes it can be a blend of aspiration and biopsy. Now, let us see what is there in store for us. Is this an exam slide? A question to you and me. Let us find out the answer towards the end. There are several methods of learning. You people should have the checklist. One of the most important things will be to be inquisitive. You should be eager enough or curious enough to find out what is hidden in this or what is wrong with this. Sometimes the slides which you and I do not routinely see are brought by the examiners. They are their precious possessions, which even the other examiners would not have seen. And be careful, many such a slide is faded. And so it will be difficult for us to understand, but it contains a wealth of information. Always, you people should try to find out or have a list of similar structures. For example, intracellular inclusions. It can be protozoa, it can be a fungus. What are the associated cells with it? What is the background? What are the other cells that are seen? These things people should be able to make a list of mentally. The eyes do not see what the mind does not know. Now, this is a bone marrow aspiration, let us say, because I am finding some cells which are immature, and then there is a stap form such. Of course, the erythropoiesis is being suppressed. Some cells are large and foamy. They do not seem to belong to the marrow, but I then cannot identify them because they are not usually seen. However, I am finding many such structures. There are many, just like flies around the cell and sometimes within also. I am finding some structures. Tiny structures, what are they? I should know the morphological forms of such. So, this is one. Comes in parasitology, and let us see in what way it affects our marrow and our exam. This is a promastigote form. So it is something like a tapering end, and then it has got a whipping flagellum, which helps it in the movement as well as in adhesion. There is a nucleus. Of course, any cell should have a nucleus. There is a kinetoplast. But more important for me will be this basal body. The basal body is there, and then there is an axoneme from which I get the flagellum. Now, when the conditions are not very congenial, it gets converted into an amastigote form. It is something like your cystic counterpart in the amoeba. So here again, I am able to see the nucleus, which is eccentric. A kinetoplast is still seen. There is a basal body and an axoneme. So look at this particular one. And when the atmosphere is again congenial, it can revert back to the promastigotes. This is one. And this is again a photogenic diagram of it. It is Leishmania dominans. Look at this. There are a lot of structures which we need not get confused about. Any creature will have a nucleus. Okay. There will be some vesicular bodies. They can have even Golgi apparatus and mitochondria. Something like your ribosomes, it is over there. I am more interested in this basal body and then the axoneme and the flagellum. So this is over here. And when this is going to become the amastigote form, I am finding still the basal body and the axoneme. Now, what do I see over here? there are obviously when this is the nucleus, this has to be the cytoplasm. And obviously within the cytoplasm, there are many such structures. And also, maybe it has ruptured or so. It has come out. These have come out and I'm finding them outside. They are very small and compared with it. This is obviously a plasma cell. This may be a lymphocyte. And this again, it can be a monocytoid cell. So this is one. Monocytes, histiocytes, macrophages, they are all more or less the same. What do I see? I see these structures. So this is something that I will not be very familiar with. Again, going back to it, let us have the basic thing, the leishmaniasis or the Kala-Azar. So I find the pro-mastigote form and the mastigote form over here, a mastigote form. And finally, there is the vector of this. This is important. So courtesy alamy. Even in the original picture, there has been an alamy. Look at this. The variations in this. So I'm able to see a binucleate form. There are two flagellae. Sometimes I find the nucleus towards the periphery. Again, the basal body and the axoneme. This is very, very important for me. B. So I'm finding only this. So there is a dot and a dash. So there is a dot over here. There is a dash. So this is important. Please do remember dot and dash. Variety is the species of life. Life is a cycle. So what is the cycle over here? Transformation to amastigote form. The amastigote form is one of the host cells. So here I find the nucleus and the dot and dash. The Leishmania donovanae is being carried to the various organs to cause a visceral leishmaniasis. Sometimes it can be in the free form in the peripheral blood also, but very rare. Usually you will get a bone marrow. And then there is the skin, there is the sandfly. That is the vector in this case that carries it, and ultimately again through a bite, it re-injects it into the another human being. And you find that the cycle develops. So it is not able to complete, it enters the cell, becomes a mastigote. Are you able to see any comparison between this and this? Look at it carefully. You find that there is a nucleus, dot and dash. So here also I'm finding a dot and then a dash. Dot and a dash. And forget this cell whatsoever. It can be a monocyte or a histiocyte or some macrophage whatsoever. I am interested in multiple inclusions over here which are having a dot and dash configuration. So this is the life cycle over here. This, thanks to Britannica for this one and Nature for this one picture. You find that there are intracellular amastigote form and there is a proliferation of it. There is a lysis of the cell, there is a liberation. And sometimes it can be re-phagocytosed by another cell, it grows. Or sometimes they can be released into the peripheral blood and there is a sandfly that is biting us. And you find that there is again an attachment, the same story continues. Now look at this. This picture is there over here. Now what I'm trying to say is, this is a cytology smear, whereas the previous one was for us a histology one. Generally, we say that histology is better in our diagnosis. But in this, I am not able to make out anything. Everything appears to be Greek and Latin or more or less similar. Whereas in the next one, I do find different kinds of cells and there is a large cell. This is exactly what you people will be finding in the slide. Not all cells will be having, but there will be larger cells, histiocytic with a bubbly cytoplasm with multiple inclusions. Sometimes there can be a rupture of the cells and the release of these cells. So this is one area where cytology scores over histology. Thanks to Nature Reviews for this picture. The visceral leishmaniasis, various things are there, and this is one beautiful reference. That is why I put this up. You people can go to it for the completion, or at least your Chatterjee parasite. So this is the world map of it. Just see, the history can be something like this. So this is again somewhere in the America that you people see, the central part of it. This is Europe around the Mediterranean, the northern part of Africa. Then probably the Saudi and the Afghanistan areas. And when it comes to India, it will be some areas like Baroda, etc., where a belt of it up to Bihar can be affected. So there are some students, there are some juniors of mine who had said that they do see these cases regularly. Therefore, if you are given a history as such, people should be able to make or take advantage of it. Now, what is the CL, PKDL, and VL? CL is cutaneous leishmaniasis, PKDL is post-Kala-Azar dermal leishmaniasis, and VL is visceral. So, again, obviously, this is the liver. I am able to find the strands of polygonal hepatocytes with a space, and there are some foamy cells over here. Whenever there are foamy cells, the list is never ending. Think of histoplasma or entamoeba histolyticum, the trophozoitic stage, Kala-Azar, mycobacteria, coccidioidomycosis. You people should think of these things and something will hit you. And even if you do not see all the slides, try seeing the pictures of it. You may be having something for your exam. So this again is the stage. You find there is a sandfly and there is the human stages of it. So ultimately you find there is a sandfly and that is injecting it into the human being, and then there is a growth of it, the promastigote and then the amastigote form. The sandfly again takes it. There is an internalization. It goes within the parasite, divides within the gut, and again it is being injected into the host. Thanks to this reference for the beautiful life cycle that they had given. Again, a superb picture. Please do read this. I am not stealing it, but they're promoting it. Jerome Brookman, In Praise of Parasites. A superb book. I hope I lay my hands on them and then read it. Look at the fantastic picture and the amount of attention that the author and the artist have given to it. Thank you.